Hi everyone, today we are comparing the UK and the US on their healthcare systems and how they deliver those services to the people. The US is considered a market-based system and not necessarily a social system. So our market-based system has a competition between employers, government, and private insurance companies. Most of our people get our insurance and coverage through employers. We also have different low income and government based systems in place, such as Medicare and Medicaid, which are usually for poverty stricken communities, as well as children under 5 and senior citizens over the age of 65. The United States healthcare system is funded by a combination of federal, state, and local government, as well as private insurance and individual payments, meaning you either have private insurance or you pay out of pocket. Usually when you pay out of pocket, it varies between states, but Florida is known to be one of the highest. Personally speaking, we went through a situation earlier last year where my family members, about 3 of them, were employed, but they were not working enough hours to cover them. They weren't over 65 either, so they had to do out of pocket, which was about $984 a month, which was the entirety of what they were making. So they were really just working to make coverage, which speaks volumes for our market insurance. Based on what I've learned and what I've read throughout this course on just U.S. healthcare, there's really no right answer on where we should go, but where we are is not the solution. Servicing the system, the way that our country services the people is through doctors, physicians, communities, and hospitals. Doctors establish their practice and they choose on how they practice and where. Physicians are paid through an FFS system, which is a fee for service. They charge you for what they are doing. So operations are pricey, elective procedures are pricey. Anything that isn't practical or basic care, like physicals, shots, blood pressure checks, anything like that, is usually going to be pricey. You break a bone, you end up in the ER. That ER visit is going to range anywhere from $1,000 to $8,000. Having a baby in the US is extremely expensive. I speak from experience. First child I had was about $12,000. Second child I just had was about $16,000, meaning within the last 2 years, it's gone up about $4,000. My epidural alone was almost $5,000, and labor and delivery, just the labor part, was about $9,000, and the rest came from the 3-day stay or 2-day stay at the hospital and different checkups. So my doctor was a private doctor that I chose. It was an in-network doctor, thankfully, for the insurance, so it did cover it. Had it not covered it, I would have paid out of pocket, and it would still be far more than what the insurance was gonna cover this time. Hospitals here can open and close based on community resources and preferences. So most of our hospitals are open 24/7, Monday through Friday, including Saturdays and Sundays. You can walk into any ER and be serviced no matter your coverage. A lot of times for the American people, that's their only option. A lot of Americans don't have good coverage or enough coverage, so they have to go to the ER and be seen for minor things because they know they cannot be turned around. Also, most hospitals are privately owned here. They're not owned by the government. They're usually owned by owners, banks, but they're privately owned, so they work a lot different than, say, Tokyo, or in this case, UK is what we're comparing it to. The majority of the American population is covered by private insurance through their employer, as I said, but some purchase it directly through a non-group health insurance So here we have Aetna, Blue Cross, United Healthcare, things like that. A lot of times you can go to different health markets or events in the community and get brochures, and they have different selection plans based on your comfortability of what you want to pay. It can range anywhere from $400 to $2,000 a month, but if you're going to pay out of pocket, it is just that. You pay what you're willing to pay to those companies if you're not going to do employer-based insurance. Now we are comparing it to Great Britain and their system. Great Britain is considered to be a world leader in preventative medicine. It has longer health statistics, a longer life expectancy compared to the U.S. No insurance premiums or copays, which is the biggest difference. It's financed through taxpayer money, and they do have government-owned hospitals, which we do not have. Having government-owned hospitals is great, but it also has a downside, and we'll get into that a little farther down. Because taxpayers pay for the coverage in the hospitals, they really get it all. Now they do have to pay higher taxes than we do, but they are covered. They don't have to worry about whether I'm going to be covered if I don't work for a month, or whether I will be covered and seen if I need a specialty care, like I broke an arm, or I need a hip replacement, or I need heart surgery, something like that. One of the biggest services between the UK and the US is they have the NHS system in place. The doctors in the UK are government employees, which we do not have. Doctors here have their salary based on what they want to get paid and what they service and their specialties. The UK doctors are government employees and earn a government salary instead of the FFS system that the doctors run on here. The upside to the NHS system is there's little to no wait time. There are no medical bills. The people in the UK don't fear bankruptcy due to medical care, and they also don't have to worry about choosing in-network providers for physicians, checkups, or emergency or hospital care. We have to worry about that because we have to stay in network within your insurance coverage to be covered. You don't have to worry about that in the UK. Some of the services provided by the UK NHS system are maternity care, birth control and sex health services, treatments with consultants, hospital treatment in case you're in an accident or an emergency, general practitioner consultations, meaning blood pressure checks, headache checks, yearly physicals, shots, flu-like symptoms, anything basic that we go here that we usually have to pay for, even if it's a small amount, they don't have to worry about it. Minor injuries and treatments for clinics, things like a broken arm, a headache, ear infection, UTIs, things like that. In the UK, the NHS system works better for primary and emergency care rather than elective care. We define primary care as healthcare at a basic level for people, making an initial approach to see a doctor. So if you have any flu-like symptoms, if you start to get a rash, if you have heart palpitations or blurry vision and dizziness, you can go to your general practitioner for basic care, and they can provide the assistance you need there. They also have emergency care. So we have if you have a concern with the care of illness or injury requiring immediate medical attention, if you're in a car accident, if you were stabbed, if you were chopping onions and you cut off your finger, things like that, it has to be an emergency for them to treat it. But emergency and basic care are really good in the UK compared to here. Elective care, that's where it gets a little iffy. So because it's taxpayer money, they cover a broad spectrum of things, but it means kind of a basic you must need it type of care. Elective care in the UK isn't necessarily fully covered, and if it is, it is not deemed as important as emergency or general practitioner care. Elective care can be considered a procedure elected by the patient and the physician that is advantageous to the patient but not urgent. Things like a hip or knee replacement, you are electing to do that surgery. It would benefit you to do that surgery, but you do not need it at the moment to survive. The gatekeepers of the NHS would be the general practitioners, which here we would kind of call like a family doctor. The system has a GP. They get paid a fixed government salary. They earn bonuses for the more patients they treat, the more bonuses they get. This helps reduce wait times for clinics and hospitals, and it also helps with waiting for specialists. So they're considered the gatekeepers because they have to refer you to a specialist if that's what you request or if that's what you need. They have to do a full check out and check all the boxes on the list for you to be referred to a specialist, or else you cannot go or it won't be covered. This is all I have for the presentation in comparison to the UK and the US. Both of them are very different. Like I said, what I've learned is there is no right or wrong system. The US system is not something that other countries look at and want to mirror. And the US has actually tried to reform its system for the past couple of years, probably since the early 1970s. We've seen different changes like in Medicaid, Medicare for older people and the younger generation, as well as the poverty income-based people. But at the end of the day, there is nothing that has really changed. It is still out of pocket or employee-based. We have a very different system. It is a very broken system, and not a lot of American people can afford it. Obamacare did kind of change that, but as I have researched, it is not for everyone. You really have to either make no money at all to be able to qualify, or there are lots of loops and health issues that you have to have in order to be covered by that. I hope that one day the US healthcare system changes from a market to a more socialist approach like the UK, but most Americans don't like the government in their hands or pockets. So unfortunately, the government controls a lot of what we do here. Having them control the healthcare system wouldn't really be much of a difference.